Welcome to Science Access. In today's class, we'll be talking about the filarial worm, and in particular, we'll be discussing in details about the Wuchereria bancropti. If you know you are new to this channel, please kindly subscribe. Now, let's discuss an overview of the filarial worm. The filarial worm are long, thread-like parasitic nematodes that actually inhabit the lymphatic glands, the tissues, and cavity of the body. The larval form is called the microfilaria, and various species of the filarial worm can be differentiated by their using microfilaria. For example, you can use the nature of the tail of the microfilaria to differentiate the filarial worm. Some are actually shielded, some tails are shielded, while some are not shielded. Even presence or absence of nucleus, or even the number of nuclei, can also be used to differentiate filarial worm. The filarial worm have an intermediate host in the form of arthropod. The arthropods actually serve as their intermediate host, and they usually possess greatly reduced lips and buccal capsule. Note that in this case, some are actually absent in some cases. Take note of that. They also exhibit what we call periodicity. The periodicity in this case, they can vary in terms of their number during the day or at night. Those that have high number during the night are said to be what exhibit nocturnal periodicity, while those that have high number during the day are said to exhibit diurnal what periodicity. Note that the Wuchereria bancropti actually exhibit nocturnal periodicity, where they are more in numbers in the peripheral blood system during the night, while lower is said to exhibit what diurnal what periodicity. Take note of that. Let's take a look at the classification of the Wuchereria bancropti. Now, the classification is being displayed on the board, and you realize that they actually belong to the family Onchocercidae. Now, this family are actually parasites of man as well as domestic animals. They can also parasitize reptiles as well as birds. Please take note of that. Now, let's discuss the Wuchereria worm in particular. The Wuchereria worm is said, the Wuchereria worm actually causes the popular or the common disease regarded as what elephantiasis or lymphatic filariasis. It can also be called bancropti filariasis. They are actually common in tropical and subtropical region, and they are actually transmitted with the aid of various genera of the mosquito. So we have the Colis mosquito, the Anopheles mosquito, the Aedes, or even the Marsonia. These are various genera of mosquito that can actually transmit this infection, disease or this organism to the definitive host, which is man. Please take note of that. Let's discuss about their morphology. Now, as you can see on the board, the filarial worm have both male and female. The female is actually larger than the male, as you can observe on the board, and you realize that the tail of the female is actually pointed, possessing the uterus, which is filled with what? Microfilaria. It also has the ovaries and definitely the vulva, as you know, for the female organ. While for the male, you can see that it has a curved tail region. Now, take note of the fact that the male have the male copulatory organ, which is definitely the testis, while the female have the ovary. Take note of that. Now, you realize that the tail side is actually more pointed for both organisms, while the anterior side or the posterior side is actually more pointed, while the anterior side is actually kind of blunt. You can see the structure. From the structure, you can observe that they have a simple mouth, the pharynx, the esophagus, and the intestine is actually what? Present. Note that, as I said earlier, the male is smaller, usually ranges in size from 4 centimeter to what, 5 centimeter, while the female can range in size from what, 8 centimeter to 10 centimeter. Now, note that the microfilaria is actually smaller than the adult form, as they range from 250 micrometer to around 300 micrometers. You can see the diagram of the microfilaria is being displayed on the board. Let's talk about the life cycle of Wuchereria bancropti. Now, the life cycle of Wuchereria bancropti, let's start from the stage where it is inserted into the body of human being. It is actually inserted into the body of human being when a mosquito that carry the infective stage, which is the L3 stage. Please take note of that. The L3 stage is the infective stage of the microfilaria. We have the L1 and L2 stage microfilaria. So the L3 stage, which is the effective stage of the microfilaria, when the mosquito feed on blood through these proboscis into the body of human to take blood, the L3 stage, which is the effective stage in the proboscis, is inserted into the bloodstream. Now, this passes through the lymphatic vessels and tissues and migrate to the lymphatic system. Between 6 to 12 months, it develops into the adult form. Now, note that in the lymphatic system, where it develops into the adult form, it mates, undergoes a reproduction, mates, and produces microfilaria. Now, note that the microfilaria that is produced in this place is actually the L1 stage, L1 stage of microfilaria is actually produced. So once the L1 stage of the microfilaria is produced during the night period, remember we mentioned that it undergoes nocturnal periodicity. So the microfilaria produced in this in the lymphatic system migrate towards the peripheral blood system, towards the skin, the blood system towards the skin during the night period. And when a new mosquito is actually come to feed from that infected human, they take in this L1 stage. They take in this L1 stage. In the body of the mosquito, the midgut actually, this L1 stage undergoes what we call molting to form the L2 stage, and eventually they metamorphose or they change into the L3 stage, which migrates to the proboscis or the mouth region. When they feed on a new human again, the cycle will begin again. So it's a very simple process. Let's talk about their pathology and clinical features. Now, take note that the pathology of this organism or this parasite can be divided into three stages or phases. We can decide to divide into incubation phase, the acute, and the chronic phase. Take note, take note of that. The incubation phase, the acute, and the chronic phase. Now, the incubation phase, remember the fact that this parasite is inserted into the bloodstream of humans, and it takes about 6 to 12 months for it to develop. So during this period, most individuals may be asymptomatic. They may show no symptoms at all. So we can regard this phase as the incubation phase. But however, in people that their immune system is compromised, they may show some few symptoms such as headache, slight fever, or even slight inflammatory response. Now, in the chronic phase, where these organisms have developed to maturity and start mating and releasing microfilaria into the blood, into the lymphatic system, we can regard this phase as the acute phase. Now, this phase is characterized by inflammatory response, where the microfilaria being released elicit inflammatory response as well as the adults. Then we start seeing the blockage of the lymphatic system, which may even lead to lymphedema. Now, lymphedema actually is a term used to describe when the lymph start building up in the body, in the parts of the body, such as the leg, the breast in female, the scrotum in male, and parts of the body, as it starts building up, resulting in swelling. So that is called lymphedema. All right, the lymph build up as a result of the lymphatic system or the vessel being blocked. So it can result in lymphedema and various other. We can have the hydrocele and various other symptoms being or effect being resulting from this infection. Now, in the chronic phase, if this period lasts for a long time, in severe cases can result to elephantiasis. That's where you see a picture of this disease is being displayed on the body. You can see the swollen of the leg. Elephantiasis. This is as a result of what? This infection being in the body, this organism being in the body for a long time can result to elephantiasis, result to serious inflammatory reaction, obstruction of the lymphatic vessel, various effects. Secondary infections can even come into place, resulting to death in some cases. So we can describe the pathology of this organism is a very simple description as a result of the organism's activities in the body of living of humans. Now, take note of that. Let's talk about the epidemiology. Now, as I mentioned earlier, this organism is usually found in tropical and subtropical region of the world. All right, in part of Africa, in part of Asia, Pacific Island, and even the Caribbean is found in part of this region. It's estimated globally that about 12 million people are actually infected, and a high number is also at risk of this infection of this what parasite. Take note of that. The epidemiology of this parasite is actually influenced by several factors, such as the availability of the mosquito, appropriate mosquito, which actually transmits this, and also the local ecology, suitable local ecology is also very important for the distribution of what this parasite. Please take note of that. Now let's talk about diagnosis of Wuchereria bancropti infection. Now you can simply do that with using what? A thick blood smell that is collected from the peripheral blood. You observe it for what? The microfilaria, for the presence of the microfilaria. All right. Take note that the blood is usually collected between the period of 10 p.m. to 2 a.m., where the microfilaria actually migrate or they have high number. Remember, they exhibit nocturnal periodicity, so they are high in numbers in this region, in the peripheral blood system, in the peripheral blood in this particular time. All right, you can also use the skin and immunodiagnostic test, but this is actually not specific for this, so it's not too sensitive. All right, now let's talk about the treatment of this parasitic infection. Now, note that the common way to actually, the most common method of treating this is the administration of what? Diethyl carbamidazole, which is employed to kill the microfilaria and the adult form. It's often used in combination with ivermectin. Ivermectin is also a drug used in combination with the first one, diethyl carbamidazole. Also note that there are reports of the use of metronidazole to treat this infection. Let's talk about the prevention and control. Prevention and control can be divided into two. You can divide one into what? The vector control, which you can do using mosquito repellents to chase away mosquitoes so that you not insert the parasite into your body, using mosquito netting, changing the local ecology. How do you change the local ecology? Destroy the mosquito breeding sites, clear bushes, ensure that there's no stagnant water in your environment, and just keep the environment very tidy. That can control the vector, which is mosquito. Please take note of that. You can also do public health is another simple method of um, controlling and preventing and controlling this parasitic infection. Educate the populace regarding, especially in endemic condition, so that they can take the appropriate what precaution. Mass administration of anti-filarial drugs can also help in endemic area to reduce, to control this, to prevent and control the infection of this nature. Note that the application of insecticide, DTT, the mass application of what insecticide to eradicate or to destroy, to reduce the population of mosquito can be employed in some cases, but this is actually discouraged because of the ecological impact. Note that it may disrupt the food chain. Mosquito play or they have their role in our ecological system. So that's the reason why I didn't mention that when I was talking about the vector control. This is the end of this lecture. In my next filarial series, I'll be talking about the Onchocerca volvulus. All right, so please take note of that. Thanks for watching. Please subscribe to support this channel. Thanks for watching.